The doctor-patient relationship is a unique and sacred bond. It's built on trust, vulnerability, and the shared goal of healing. Patients entrust doctors with their most private fears and deepest hopes. Doctors, in turn, shoulder the responsibility of providing care with expertise and compassion. This relationship, however, is not without its challenges. Modern medicine is complex. Patients often grapple with unfamiliar medical terminology, fear of the unknown, and the emotional weight of illness. Doctors, too, face pressures, time constraints, administrative burdens, and the ever-present reality of human suffering. These challenges constrain even the strongest doctor-patient relationships. Despite these complexities, a strong doctor-patient relationship remains paramount to effective healthcare. Open communication, empathy, and mutual respect form the bedrock of this bond. When doctors and patients work together as a team, navigating challenges becomes a shared journey towards healing and well-being. Imagine a patient sitting across from their doctor, a sense of dread building in their chest. The doctor, using complex medical jargon, explains the diagnosis. The patient, overwhelmed and confused, nods politely, understanding only fragments of what's been said. This scenario, unfortunately, is not uncommon. Effective communication is the cornerstone of a strong doctor-patient relationship. Yet, the language of medicine can often feel like a foreign tongue to patients. Doctors may unintentionally use technical terms, forgetting that what seems commonplace to them can be bewildering to someone outside the medical field. Doctors can bridge this communication gap by using clear, concise language, avoiding jargon whenever possible. Visual aids like anatomical diagrams or simple drawings can further enhance understanding. It's crucial to check for comprehension regularly, asking patients to reiterate their understanding in their own words. This ensures that patients are active participants in their healthcare, not passive recipients of information they struggle to grasp. Culture shapes our beliefs, values, and even our understanding of health and illness. A doctor-patient relationship that disregards cultural differences risks miscommunication, mistrust, and ultimately, compromised care. Imagine a patient whose cultural beliefs influence their perception of certain treatments or medications. Doctors must approach each patient as an individual, recognizing that cultural background plays a crucial role in healthcare decisions. This requires active listening, respectful inquiry, and a willingness to learn about different cultural perspectives. For instance, a doctor might ask about home remedies or traditional healing practices that the patient may be using. Integrating cultural understanding into treatment plans is essential. This doesn't mean compromising medical standards, but rather finding ways to bridge cultural beliefs with evidence-based medicine. It could involve incorporating traditional practices alongside conventional treatments when appropriate, or explaining medical procedures in a way that resonates with the patient's worldview. The internet has revolutionized access to information, including health information. Patients now arrive at appointments armed with stacks of research, often gleaned from medical websites or online forums. While this can empower patients to be active participants in their health, it also presents new challenges for the doctor-patient relationship. Doctors may encounter patients who are misinformed or overwhelmed by the sheer volume of often conflicting information online. Some patients may be hesitant to accept a diagnosis that contradicts what they've read online, leading to tension and distrust. Instead of dismissing patient research, doctors should acknowledge its value while providing evidence-based context. They can guide patients to reputable sources of information and help them discern credible medical advice from misinformation. Openly discussing concerns and addressing anxieties stemming from internet research can foster trust and ensure that patients feel heard and understood. Doctors are not immune to life's challenges. They experience grief, stress, and personal struggles just like anyone else. While doctors strive to maintain professionalism, it's important to acknowledge the human toll that their work can take. A doctor grappling with a personal crisis may find it challenging to compartmentalize their emotions, potentially impacting their interactions with patients. Seeking support from colleagues, mentors, or therapists is crucial for doctors to maintain their own well-being. Hospital systems can play a role by fostering a culture of support and providing resources for doctors to address burnout and compassion fatigue. Ultimately, acknowledging the human dimension of being a doctor allows for greater empathy towards both patients and oneself. delivering difficult news, compassion as a guiding light in times of uncertainty. Few tasks in medicine are as emotionally charged as delivering a terminal diagnosis. In that moment, a doctor's words carry immense weight, shaping the patient's understanding of their own mortality and influencing their remaining time. Conveying such news with compassion and empathy is paramount. There's no script for delivering life-altering news. However, certain principles can guide doctors in these delicate situations, creating a quiet, private space for the conversation, using clear and direct language, and allowing ample time for the patient to process the information are essential. Equally important is the doctor's presence, conveying empathy through words, tone of voice, and body language. The healing power of shared decision-making, empowering patients with knowledge and choice. Gone are the days of paternalistic medicine where doctors dictated treatment plans and patients passively complied. Today, the emphasis is on shared decision-making, where patients are active participants in their healthcare journey. This collaborative approach recognizes that patients are the ultimate decision-makers about their bodies and their lives. Shared decision-making begins with clear, comprehensive information. Doctors must present treatment options in a way that patients can understand, outlining the potential benefits, risks, and alternatives. Visual aids, patient decision aids, and educational materials can empower patients to make informed choices that align with their values and preferences. Building bridges, not walls, fostering open communication for improved health outcomes. Open, honest communication is the lifeblood of a strong doctor-patient relationship. When patients feel comfortable sharing their concerns, fears, and preferences, it paves the way for more effective diagnosis, treatment, and overall care. Conversely, communication breakdowns can lead to misunderstandings, medical errors, and eroded trust. Creating a safe and welcoming environment is essential for fostering open communication. Doctors can encourage dialogue by asking open-ended questions, actively listening to patient perspectives, and validating their emotions. It's equally important for doctors to be mindful of their own communication style, ensuring that their body language conveys openness and approachability. The enduring impact of a strong doctor-patient relationship, a foundation for healing and hope. The doctor-patient relationship is more than just a transactional exchange of medical services. It's a human connection that can profoundly impact both parties. When this relationship is strong, built on trust, empathy, and mutual respect, it creates a powerful foundation for healing and hope. Patients who feel heard, understood, and respected by their doctors are more likely to adhere to treatment plans, experience better health outcomes, and report higher levels of satisfaction with their care. For doctors, cultivating strong relationships with their patients can bring a sense of professional fulfillment, knowing that they are making a tangible difference in the lives of others.